Kaya PM Biz with Stevie B. Only on KayaFM. You have no business listening to anyone else. Kaya PM Biz with Stevie B.
Now, the story that made big headlines last week, and of course this is going to continue for a while, is the National Health Insurance. The NHI contributions will be mandatory for all those earning above a certain threshold. That's what we read, and that's according to the green paper on the scheme released by the government today. We saw the health minister releasing the paper, unveiling it, and the challenge will be to utilize the strengths of both the public and definitely private healthcare sectors to better service the public. On the line, we got the Managing Director of Genesis Capital's healthcare subsidiary and Genesis Healthcare Consultants, Craig Samsodien. Good afternoon, Craig.
Good afternoon, Steve. How are you?
All right. This is a story that's making headlines and will continue to do it. How do you view the announcement, first of all, Minister Craig?
Well, I think, firstly, because we're in the medical scheme industry as healthcare consultants, we certainly welcome the fact that private healthcare will exist alongside the NHI. We always figured that government could actually use the expertise and special skills that exist within the private healthcare sector to support and start up NHI, and we certainly see that this is going to carry on.
Do you think it's workable?
Of course it's workable. I think that if we look in South Africa, and even on other European countries, we see that 6% of GDP is used for public health care.
Right.
And certainly that's what we're spending in South Africa at the moment. I just believe that, the starting point is correct. We see that government is starting to improve, firstly, the state facilities in preparation for NHI. And I do believe that is to provide universal health care and certainly to reduce the private health care cost that everyone's been complaining about.
Will the private sector and government not really be ganging up against the middle-income consumer?
No, I doubt that. I think that, years ago, Council for Medical Schemes came up with the strategy of a basic benefits package. And this package was to provide a certain amount of benefits for everyone on medical aid, similar to the prescribed minimum benefits that we know today. So what we see happening is that NHI will provide that basic benefits package for all South Africans, and medical schemes would provide a top-up sort of supplementary insurance similar to what we see in the UK and European countries.
What is the appropriate earnings threshold for consumers?
Well, I think the biggest challenge at the moment is the low-income earners, and we're referring to possibly, estimate people earning under 5,000 Rand. I would imagine that government would use the same sort of figure where people are exempt from paying tax, and that would be about 4,750.
Yeah.
So I think above that threshold, that's when citizens or those that are employed would start contributing to NHI.
Will the NHI have a situation where they'll be squeezing middle classes, do you think?
I think that certainly, the medical scheme industry, Steve, as you know, is extremely resilient. They're very innovative, and, they've been through a myriad of changes from council and regulation. And what I believe would happen is that the schemes that as administrators would develop really unique products to supplement NHI. Invariably, yes, it's going to have and I think the goal is noble, and that is to get universal coverage for all. And from what I've seen, and certain real major industry role players I've been talking to, is that they all want to work together to achieve this universal health care for all citizens in South Africa.
So nobody would disagree with you, and the goals are certainly well meant. Do you think we're going to be able to pay for it?
Well, that is exactly where it comes in. I would imagine that what I also need to point out is that, there's a lot of emphasis on the NHI and the cost thereof, but, the Minister also alluded to one of their strategies, and that is to reduce the cost of private healthcare simultaneously.
Yeah.
I think if that happens together with introducing NHI, then we stand a good chance of it working. Also, it depends on what the cost of NHI is. If hypothetically you were going to spend 1,500 contribute, certainly cannot afford medical aid. Or private healthcare for that matter, but if you are contributing, say, 200 Rand to NHI, I would say a fair amount, significant portion of the middle class would still be able to contribute to medical aid.
Contributing is one thing, but what about the people who contribute towards the system, who are never going to use it? Is that fair?
Well, the same thing happens, today. How many taxes do we pay that we don't really benefit of, but we still pay it, It's just an unfortunate set of circumstances.
Yeah.
I believe the affluent will always seek to have some form of private care or security for that matter.
Yeah. All right. Interesting stuff. And, if it's good for the major of the population, it's good for me. Thank you so much.
Absolutely.
Thank you so much, Craig Samsodien from Genesis Capital. We appreciate you being on the show.
All right. Keep well then.
Okay. Vibration we see a lot of people paying.